Imtiaz. I'm one of the dentists who works here. I have an interest in paediatric dentistry. I'm currently studying in the final year of my master's in paediatric dentistry at the Eastman, and I've been working here since February this year. And I've really enjoyed working here. It's a great practice, it's really good teamwork. We get to have that input from more at the early stages with children, which is really important because it helps us to plan for the future, particularly with interceptive orthodontics. The sooner you get in, the sooner you can correct something rather than waiting till the children are a bit older. The Department of Health recommends that you take your child from the first tooth first visit, so I'd recommend that everyone takes their child from when they see the first tooth in their mouth, and then every 6 months after that. I think it's really important from the point of view of familiarising a child that they're not anxious about the environment and they adapt to it. So if they're just going for a checkup or watching their parents have a checkup, then eventually when they need to have treatment, they're not so worried about what they're seeing because it's just like a second home almost. So that's the most important thing. From a long-term point of view, you don't want a child to end up needing a general anaesthetic. The treatment, you want them to see it as something that they're accustomed to, that they've seen, but hopefully they're not going to need treatment if they're coming regularly and having good checkups and prevention, because prevention is key rather than treatment. I think it's important to see any dentist. I think the difference between a general dentist and the dentist who has an interest in paediatric dentistry is that their approach may be slightly different. It depends on the child. I think ultimately you want to have a friendly environment. The word is here at Mora's, I think it's very child friendly, and I think that makes it instantly welcoming for the child. So they're not put off, it's not very clinical, it's not sort of directed towards adults, although we see a lot of adults, so I think they like the environment. But I think it's quite a family-oriented practice, and I think family is probably key, so that children don't see it as a separate place necessarily. And paediatric dentists will probably be looking out for particular landmarks in a child's life and identifying if teeth are interrupting or where they're erupting or where they would expect their progression to be at a certain age in their life. So probably from that point of view, although I would say all dentists hopefully are looking for that, a paediatric dentist would probably be more aware of that and just pick these things up a little bit earlier. So I think that probably is the difference. It's like Maura was saying earlier in her talk, if it's something that somebody does all the time, then they're going to be more familiar with it and it'll just come naturally.